welcome back to the White Coat Club. My name is Lindsey, and I'm here today with Nicole, who's also a counselor at MinPrep. And today we have a very special guest. Her name is Loren, and she's one of our instructors for the Rising Researchers program. Before we get started, kind of talking a little bit more about Rising Researchers and the benefits of research, don't forget to like and subscribe to get more BSMD and med school admission advice. Loren, will you tell us a little bit about yourself?
Yeah, of course. So my name is Lauren, and I got my Bachelor's of Science degree in biology. Then I moved on to getting my Master's of Science in Global Health. So that's where I got introduced to research. And now I'm currently pursuing my MD PhD at the University of North Carolina, where I'm in my third year of the PhD program. And some of my past research interests have included traumatic brain injury, alcohol use, and substance use, including opioid use.
Can you go a little bit further into what health disparities actually means?
So, health disparities refer to systematic differences in health status, disease burden, and access to healthcare between different populations groups like racial or ethnic minorities, socioeconomic status, gender, even sexual orientation, and geographic location. So, health disparities are kind of pointing out what are the differences in how healthy a person can be. On the other hand, health equity is the opposite. So health disparities is kind of pointing out the gaps, and health equity is referring to trying to get everyone up to the same level of health. And so these systematic differences that lead to health disparities are called social determinants of health because they're factors other than biological factors that have an impact on health.
Why is it important for BSMD applicants to understand health disparities?
So it's really important for BSMD applicants to understand what health disparities are and how they might impact their future patients, because good doctors will need to understand all the aspects that can have an impact on their patient's health to prevent misdiagnosis and make sure that their patients can adhere to their recommendations. So to give you an example, if a doctor recommends their patient to have better nutrition and more exercise in order to help someone manage their diabetes, but that person lives in a place where they don't have really easy access to healthy foods or they don't have a safe environment to exercise, then it's going to be really difficult for that person to comply with the recommendations of their doctor, even if they want to. So it's important for their doctor to understand the whole picture of their patient's surroundings so that way they can really focus on how they can best help their patients. Another example could be a patient who has asthma and they might frequently visit the ER because their asthma is getting worse. But instead of changing the patient's medication, if the doctor really recognizes that maybe it has something to do with the environment, like air pollution or mold in their house, then they can help that patient to reduce what's causing the asthma attacks versus just focusing on the medication management. So, BSMD students and applicants should try to understand more about health disparities so that they can be a better doctor in the future.
So, how would BSMD programs assess applicants' knowledge of health disparities?
BSMD applicants might have to talk about health disparities or health equity in their essays. They might be asked some questions about health disparities during interviews. Children having access to gender affirming care. And this is a really controversial topic within the field of medicine. So there's no right or wrong answer, but it's important to show that you understand the aspects that go into making such a decision. In the past, we've seen interviews talk about how applicants might be prepared to treat diverse populations. So it's important to know what factors impact populations differently. And we also saw at the Baylor case competition this year that the theme was about ways to increase access to healthcare among rural populations. So if students have knowledge about these health disparities, they're going to be better able to address essay questions and interview questions.
Yeah, maybe I'm just like paying attention more to it, but it feels like maybe like even like 7 years ago when I first started working at Moon Prep, I don't remember there being many questions about it. Like maybe the pandemic really started this conversation a lot more. And I do think it is such like a positive thing for high school students to learn a little bit more about and kind of have that different knowledge. And kind of to the end, how can high school students learn a little bit more about health disparities?
Yeah, so students can start by getting involved in their communities. So they can volunteer at local health clinics or organizations focused on underserved populations. And I really recommend that while students are there volunteering, that they get involved by just asking questions and trying to learn a little bit more about how people are being able to access care, or what are some challenges that the patients that they're seeing might face, and talking to the people that they're working with and kind of getting a better understanding of how the whole system that they're working within works. Another way that students can get involved is by participating in community health fairs so they can see firsthand who are the people that might need more support and what are some of the challenges that they might be facing. And they can start to brainstorm about how can I be a part of the solution. We also have online courses. So through Coursera, EDX, and even the CDC have public health courses that are free. So this is a really great way of just educating yourself on the background information first before you kind of go out into the community and see it firsthand. And students can also get involved in research. So, whether that's public health related research or other types of research that look into the differences in different populations, getting involved in research can also help students to understand the mechanism behind how are these health disparities created, how are they perpetuated, and ultimately, how can we strive to solve them?
So you bring up a really good point about doing online research, and I guess that's going to kind of segue into what we'll talk about next, and that would be the Rising Researchers offerings for this upcoming summer. So Rising Researchers typically will have 12 sessions. They're online, meeting about twice a week for about an hour and 15 to an hour and a half per session, depending on what the topic is and which session you're doing. The other great thing you get out of it is a guaranteed publication. So it's something great to have on your resume. All students that work with their research mentor on a literature paper, and they also do a poster. The mentor guides the student through the publication process. So the student does not have to have any true prior knowledge of how to do that. Um, and as long as the student receives a B or higher, they're able to be published in the journal. Another great benefit is they receive a letter of recommendation. So students are able to request strong, tailored letters of rec that will help the admissions staff recognize their accomplishments, unique characteristics, and leadership qualities on those college apps.
There'll be two different topics. So I'll talk a little bit about Dr. Jetty's topic, biology meets no code AI and machine learning programming. Essentially, it's bioinformatics research in medicine or microbiology for beginners. So this class is taught by Dr. Jetty. She's a professor at UMass, and she's been with us since the beginning of Rising Researchers and definitely does have a lot of experience teaching students. One thing that I always explain to prospective families who are interested in her class is that as it says in the name, it truly is for beginners, because she'll teach you like everything that you need to know. So essentially, she's going to help you learn and design a research topic in a human disease or a microorganism. And you'll be using the scientific method with AI and machine learning. And once again, you don't need to know any coding because you'll be using like no code bioinformatics platforms that are used by scientists today. Now, this is a really customizable class, and Lawrence is as well, because everyone will be studying their own human disease. You can really tailor it towards your specific interests and needs to kind of fit your maybe narrative arc. And Dr. Jetty will help you figure out which human disease might be best for you. But through those courses, you will learn how to review literature. You'll identify a research gap. You will be collecting and analyzing large biological data from several bioinformatics databases and tools. And one thing I always tell people too is like she really does meet you at your level. So if you are a little bit more advanced in AI machine learning, she does make sure that you still are challenged. If you don't know anything, you won't be so challenged that you aren't having a good time. So I do think she does a really great job of just making sure that everyone is having a good a good class and having a good experience and really able to take that knowledge maybe and apply it elsewhere in their future. This session will be taking place over the summer. So it starts on June 23rd and it runs through August 4th. And so it's every Monday and Thursday. And the classes will be from 4:30 p.m. to 6 p.m. Eastern or 1:30 p.m. to 3 o'clock p.m. Pacific time. If you sign up by June 6th, you do save $200. Total cost of the program is going to be $3,700. But if you sign up before June 6th, it'll bring the cost down to $3,500. And if you have any questions, you can go on the Rising Researchers page and sign up for like a free consultation call, or you can go ahead and sign up right on the website.
The next session will be taught by me, Lauren, and it is called The Social Determinants of Health and Cardiovascular Disease. And we're going to be focusing on the intersection of public health and medicine. So we're going to dive into all of the topics that we just talked about related to health disparities and social determinants of health. And then students will have a chance to apply their knowledge and see how do the social determinants of health relate to cardiovascular disease, and each student will get a chance to pick their own topic. So within the health disparities, which one is the most important to you? Within cardiovascular disease, which one's the most interesting to you? And students will have a chance to learn how to search the scientific literature and read the scientific literature to understand more about their topic. And taking it a step further, students will get a really in-depth tutorial on how to write a scientific paper. So we will go through each section of the paper and how to write it so that by the end of the course, each student will have a publication-worthy research paper. And taking these skills to the next step, students will be able to learn how to search the scientific literature so they can do it on any topic that interests them in the future. So even if you dive into one aspect of health disparities during the class, nothing is stopping your students from using the skills that they've learned in the class and learning about another one on their own time. So it really gives students the ability to conduct their own research and learn how to think like a scientist. And so this class will be taught over the summer as well, and it starts July 8th and runs until August 16th. And it will be held every Tuesday and Saturday at 6 p.m. to 7:30 p.m. Eastern Time or 3 p.m. to 4:30 p.m. Pacific Time.
And same as before, if you have any questions, you can sign up for a like free consultation call on the Rising Researchers website, just www.risingresearchers.com. And then you'll find the contact link there. Or you can go up and sign up for the class directly on the website if you don't have any questions. So I think that's it for us today on research and health disparities and how beneficial it can be to BSMD students. If you haven't done so already, don't forget to like and subscribe to get more great BSMD content. But we'll see you next time.